with our mission. Just want to point out this brings out the part that we are working hard and diligently to foster partnerships within the community as we continue to work together to do this work. Next slide, Vicki. So the point of this slide is just to let you guys know that we are stretched across 4 different counties. Oftentimes, individuals state they didn't know we were in all those different places. So we always like to take an opportunity to share that. Could you go right back for me, Vicki? Go back.
Oh, sorry.
That's okay.
Keep going.
Can you go back to the
Am I going the wrong way? Yes, I am. Sorry. I am. I need to fire the person here. Okay, go ahead.
Okay. All right, go to the next one, Vicki, to our locations. Right there.
Okay.
Yes. So again, I just like to highlight this particular slide just to let individuals know that we're stretched across 4 different counties. Today, we're going to highlight our presence in the Charleston County area, but we're in 4 different counties throughout the Lowcountry as well, and we have over 25 different locations. Particularly for the purposes of today's presentation, we want to highlight the 2 centers that Vicki mentioned as she was introducing us. We have our Charleston Family Health Center that's located on 51 Nassau Street, downtown Charleston, as well as our Enterprise Pediatric Health Centers. We're highlighting those particular ones today because we feel those are probably the locations that children and families are most likely engaged with just because of their location. Okay, next slide. Next, we want to highlight our services. I'm going to turn over to Dr. Slaughter to plug in here. Just as we know that you guys are looking to engage and work with Fettermore, we want to highlight some of those services that you guys most likely will utilize.
Right. So I know that, part of this connection is, sharing information with not only children, the pediatric population, but also families. So I did want to let you know that we do have general primary care services, medical care at all of our sites. In addition to laboratory services, and I will highlight now just some things that we have very specific to the Comstock Avenue Enterprise Pediatrics location. So we have a team that will communicate with families regarding screening, including attention deficit disorder screenings, as well as depression screenings. As you know, if anyone has gone to any of their physician's offices, everyone's had an opportunity to answer some questions regarding depression screenings, regarding the importance of communicating with everyone about the need for looking into our emotional health. We also provide all immunizations on our site, well child services, as well as acute care services. At our downtown site, we provide dental care, but also at the Enterprise Comstock location, we're on a schedule with our mobile dental team. And so at times we will also have our dental unit at our Enterprise Pediatrics site in that North Charleston area. We provide pharmaceutical services. We have three agencies, 3 sites, only 1 in Charleston County. But once families are established, if there's a need to provide additional services for patients who have difficulty getting to the pharmacy, there can be arrangements made, such as mail order and delivery at local sites, such as the Enterprise sites. We have case management services for our established patients, and we do assist with eligibility regarding setting up our sliding fee scale, or assisting families with, pointing them in the right direction to apply for different services, insurance plans, and that sort of thing. We can assist with transportation needs in terms of assisting families with getting that information. And we've even had some vouchers for the bus system that we can share with families. We have dietitians on staff. We do provide translation services, I should say, as well, all languages, using a video machine as well as just telephonically. We provide sports physicals, additional developmental assessments, and behavioral health assessments, in addition to women's health care needs, including contraceptive care.
Okay. Nikki, could you progress to the next slide, please?
These are just members of our team. These are the folks primarily between our downtown and our Comstock sites. I'm up there at the top. We have Ms. Heather Roca, who's our physician's assistant. She also assists us with managing our 2 school-based sites who are in other areas of the county. We have Dr. Morales, who's a family physician. She's primarily at our downtown site, but can also rotate through any of our sites that we need. One of our newest team members is Ms. Davis, who's also a physician's assistant, in addition to a pediatric nurse practitioner who's at primarily our Enterprise site, and our newest pediatrician, Dr. Mehta, who joined our team just a few months ago.
So as you can see, we have a whole host of individuals that if families decide they would like to engage, whether or not it's your children, we're actually kind of highlighting and focusing in on our pediatric providers in this particular presentation. We have a whole host of well-qualified individuals who are available for your families, who understand the need and some of the complex medical needs that are out there, and are willing and ready and available to assist our patients as needed. Okay, next slide. All right, how to connect. So this is the big question of the day. So if you find that you have families, or if you are a part of a family who'd like to take advantage of our services, again, we have 2 locations that you guys will most likely engage just because of location. Our Enterprise Pediatric location, which is right there on Comstock Street. Simply calling that number and letting them know that you are a new patient and you're interested in services will connect you with care. Or if you're interested in going a little further down the road to about 10 minutes away to our downtown Charleston location, which is off of 51 Nassau Street, again, calling that number and setting up an appointment will connect you with care. One of the things that is unique for our community health center is that we provide an opportunity to provide assistance to help remove any potential barriers that you may be incurring. So for example, if a new patient comes in, every single individual will get registered, and then every single individual goes to what we call a financial eligibility specialist, and that individual will work with them to get them on what we call a sliding fee discount program. And this is a program that's available not only to individuals who do not have insurance, but it's also available for everyone. So for example, if you have insurance, but maybe you have a high deductible plan that makes it a little challenging for you to seek or receive that medical care, as a community health center, we are required to see everyone, regardless of their ability to pay. And if in fact your copay deductible, if your copay, is more expensive or higher than the deductible that will be offered by the sliding fee scale program, then we will provide you with that lower price option. So we want to make it affordable for everyone, obtainable for everyone. In addition, once you see that financial eligibility specialist, they assist you with getting on that sliding fee program. Let's say, for example, the lowest possible fee, depending on where you fall, and I'll talk about what the sliding fee process looks like in just a moment. But let's say you say, you know what, I still don't, it's $30 for your visit and it covers a host of things, but I don't have it. It's just times are hard. Then we have case managers that we can connect those individuals with, and those case managers can assist with get connected with other programs. They can assist you and walk you through the process of applying for Medicaid. We can't make the decision of being eligible and receiving that, but we can walk you through that process and hold your hand with that process if you are an established patient of Better. So we have a lot of different things in place to just make it affordable for you, as well as take away some of those physical barriers. That case manager can assist with those transportation vouchers that we talked about earlier. If you have issues with unique medications and we can't afford those medications, and those same case managers can assist with various medication assistance programs. So they're just there to remove any type of physical barrier to care so that you can have the best possible experience. Okay, next slide, Vicki.
I have a question from Miss Reed. Latrina Reed has a question. I'm going to let her unmute herself so she can ask her question.
Thank you.
Hi. Well, she when I raised my hand, she was right on what I was going to ask, because I'm diabetic and I was wondering about the slide and scale and the prescription assistance, and she answered it. She answered
Okay,
it.
yeah. And we have
And
a
I
lot
have,
of,
an upcoming appointment with Fetter on the 21st, and that's what they told me to bring my ID and $30. But I hear you're saying now that if we don't have the $30, so I should just explain that when I get to my appointment?
right, they can set you up with the payment plan. One of the things that we've been working really hard with is just to make sure that we communicate well and communicate that there is a fee associated with the visit. And if you Google free clinics, Fetter will pop up. But truly, in fact, we're not a free clinic, and so that's a misconception that we're kind of addressing. But we work with you. You just explain to them that I don't have the $30, but I'm willing to pay what I can, and so you will work with them to pay what you can for your
I should just take
medication,
something.
ma'am.
So I should just take some monetary money, some
Right.
money.
Right. Offer them what you have. Say, look, I don't have that, but this is what I have. Because we don't ever want to take away the opportunity to reconnect them with care, especially if
Right.
someone's willing to work with us, and because we're always willing to work with them. So yes,
Right.
ma'am. You just make that communication to them. And then as far as your insulins, talk to them. There's a program called Well Vista. So talk to them about that. If you get enrolled in that program, that's the program that offers medications, free medications actually, that can get mailed out to you. So ask them about that to assist with your insulin needs. Okay.
Okay.
All right.
Thank
We're
you.
happy to help. Yes, ma'am. Are there any other questions like that we'd be happy to answer at this time? Because we're
Ms.
actually
Chapman?
wrapping up. Mhm.
What was the name of the company that you just said about the insulin?
Well Vista. That's WEL, and it's him with this mask. WELVISTA.
Okay.
Yes, ma'am. And then we actually have another program called MedData. It essentially is a program. It's like a database where we can plug in an individual's information, and it'll tell us all about the medication assistant programs for different drug companies. So if for some reason, well, Vista can't help us, then we have another mechanism that we can utilize that may be of assistance.
Can I ask if you guys are familiar with Neighbors Med? Have you ever heard of that? Neighbors Med?
No, ma'am, neither one of us have heard of that.
Well, they pretty much do, it's like a membership. I think they quoted like $30 a month, and it covers doctor visits, specialties, and prescription.
Oh,
Okay. Okay.
I have heard it. I didn't realize the name, but I'm familiar with the type of practice that is, yes.
Right.
Other questions? We're happy to answer them.
I think I saw a question popped up asking about, did we test for dyslexia? That would be a referral for us to an agency.
Will I be able to see specialists?
So yes, we do refer individuals out for specialty services. It just depends on the type of specialty that you're needing. We do offer, we have a nutritionist on site, and we have Dr. Effion is a urologist, is that correct?
Internal medicine.
Nephrologist. A nephrologist. He's also, but primarily internal medicine doc. So there are some things we can provide, but for the most part, we do provide outside referrals.
Okay, because I was thinking about gynecologist, if that was.
Did you say gynecologist?
Gynecologist, being a gynecologist, yes.
We provide gynecological care. We have a gynecologist.
Awesome.
Yes, ma'am. But it's in Somerville. It's at our Somerville location Monday through Thursday, but on Fridays it's at our downtown location. So,
Okay. Cannon Street?
And Patty, we have another women's health nurse practitioner as well. And we have programs that we work with, like for example, Best Chance Network. It's a program, depending on there's requirements that you must meet. But if you meet those requirements, you can get a free pelvic and a free mammogram.
Oh, okay.
So that's an option for you as well. And then we also work with a program called Choose Well through the New Morning Foundation, and they provide free contraceptive care for some of those more expensive contraceptives. I always like to throw it out there because as a female, it's a very expensive
Right.
resource. So just letting people know that that's something that's free and an option for people.
Mhm.
What are your other questions? I just have one more slide and we'll be out your way unless you guys have more
Sorry.
questions.
Jumped ahead.
No. Other direction.
My
babe.
navigation. Navigation is a challenge.
Okay, so this really does cover what I've already shared. I just wanted to share the process. We treat every patient the same. If you're interested in being a part of our practice and you're currently not a Fetter patient, you just come in and you get registered, you fill out the paperwork that's necessary. Everybody goes to a financial eligibility individual to get the financial piece under wraps, and then everybody's connected to that care. So we follow that same process. If in between any of those steps, it's identified that you need some assistance with case management, then that case management is an internal referral, a referral that's in-house. We connect you with what you need with that case manager, but with everybody pretty much following the same pathway, okay?
Yes,
All
ma'am. I
right.
got one question.
Sure.
Yes, I understand. I just heard what you said, the young ladies and the female. Do we have similar services for male patient as well?
So actually, does the Best Chance Network help with them if a male, if they have? I've heard them say in talks or when they talk about the program and give you updates that if a male has a lump in their chest, then I think the Best Chance Network will assist with that as well. And we have a lot of male providers here. I didn't highlight them because a lot of them don't necessarily, we put more focus on the pediatric team, but we have a lot of male providers here that are very, very well informed and just easy to talk to and have been with us for a number of years, and they provide services for men and women. I immediately think of Dr. Effion, I think of Dr. Poole. We have a lot of individuals here that are ready and willing to assist. Fetter is an affordable option. If you feel that you need help, you need services, we are here for you. We have a team of individuals who are committed and passionate about making sure that care is there for you when you need it. So
Thank you.
just give a call to us, let us know what you're needing. We're happy.
Gotcha. Thank you, ma'am.
Thank
We have
you.
a question about dental care. Is dental care for the adults as well?
Yes, ma'am. Dental care is for adults and children. They have a slightly different sliding fee program, but nevertheless, still another affordable option when compared to other dental offices in the area. Works the same way. You come in, you schedule your appointment now. They will have you come in if you need services and you haven't been seen before. You have to get your x-rays, kind of like when you go to any other dentist office. You have to have your x-rays done. They also will take a look at your mouth and do an examination and determine what types of services you're needing. And then from there, they will let you know, kind of like when you go to the dentist, they'll say, here are the things that we found wrong and these are the costs, and you can talk to them about what you would like to start with and where you'd like to go with that so that it's an affordable option for you. Okay?
Question.
Sure.
Do they help with braces for children?
That would be a referral out. We don't have that individual on board, but we can refer you out to someone for braces.
Thank you all for the great questions. Keep adding them in the chat room, and if we have time, we will definitely try to answer them at the end or pass them on to Fetter, and we'll connect you all to those responses as soon as we can. We're going to go ahead and thank you, Dr. Chapman and Dr. Slaughter, for your time this afternoon, and we'll move on to Sonia. Sonia Donnelly is with Palmetto Project. So we talked about whether or not you have insurance. This is the premier agency in South Carolina that will help connect families to affordable insurance options. I'll let her take it from there.
Thank you, Vicki.
Palmetto Project is a statewide nonprofit. So we are based in North Charleston. That's where our office is on Rivers Avenue. But we do serve the whole state of South Carolina. And we have a variety of different programs. Vicky, next slide. And some of them you've probably heard of, the free books for kids under the age of 5. That's Dolly Parton's Imagination Library. So we fund that. So it's free for people who are getting the books, but it's not free actually to send and buy the books. They are at a discounted price. So we do a lot of fundraising for that. You probably, we're most well known for our I Voted sticker. So if you're going to the polls and you get one of those I Voted stickers, those are printed by us. We fundraise to print those, and then we send out millions of them during election time to each of the election stations and polling stations. So we have a Families Helping Families program in the Midlands. So not in our local area, but in the Midlands, they have a Families Helping Families Christmas program. And then a program that specifically focuses on Medicaid that I'll talk about a little bit more of. The program that we're really working on right now is on the next slide. It's the Insure SC program. It's a rather newer initiative of the past 3 years. We've been helping people sign up for Affordable Care Act health insurance, also known as Obamacare or Trump Care or I don't care, so long as you go to the doctors and so long as you can afford it. And that's what we're all about, is we're really trying to make sure that you can get the care that you need. So we've been doing it for the past 5 years, and then in the past few years, we picked up Medicare as well. So we are an enrollment hub and information hub for anyone, really. If you have insurance already and you don't understand it, or you want insurance, you don't know if you're eligible, and then you can give us a call and we can do some screening, see what you're eligible for. Next slide, Vicky. So this is our little team. We are working from home mostly, but we do go into the office a couple, 3 times a week. But a lot of the questions that we have, we're able to answer over the phone. We are licensed agents, because you have to be licensed to do Medicare and to provide Medicare information. However, we also get commission, but it goes back into our program. So I don't know how much we get and all that kind of stuff. And what it does is it funds us to be able to do some more of that work that we really want to do, which is stuff that we don't get paid for: Medicaid applications, TEFRA applications, more complex Medicare savings programs, extra help with prescriptions, and putting in those types of applications for people. Next slide, Vicky. So here's kind of a list of things that we can answer questions about. I think I saw someone in the chat box put that they were getting the runaround from Medicaid. That's something that we can help with. It's what we specialize in. We'll get you to sign a form so that we can get access to the application information. And so we follow the application from filling out the paperwork to submission, to making sure that it's going through, to submitting extra paperwork and following up and trying to figure out why they've denied you or why you haven't heard yet, what's going on with it, like what exactly is it that they need. Because sometimes they'll say, oh, we sent out a letter, but no one got it. Sometimes they cut you off, you don't know why, or sometimes it's extended, you don't know why. So those are the types of things we can get questions about. Right now, Medicare just finished yesterday, their deadline, but it is open enrollment for Marketplace coverage. So that's ACA, Obamacare, whatever it is that you need. The deadline is the 15th. So if you want insurance, you do have to have some sort of income coming in, and we can look at that and we can tell you what you're eligible for and how much the plans might cost you. Sometimes they're really, really affordable. Sometimes they're not as affordable, but we don't know if we don't look, and we're happy to help you look at those. There's no cost to call us. You don't have to pay us for any services. We're just gonna help you look at what you've got and what you want. Okay, next slide. Okay, so what we offer, very unbiased information. Like if you've already got insurance, it works really well. We're gonna tell you that. If you're not able to get onto Obamacare or Affordable Care Act health insurance for some reason, we're gonna tell you that. We're gonna explain things really well, like what's a deductible, what's an out-of-pocket, what's copay, what's co-insurance. If you already have insurance through a job, we can also explain that. Like sometimes you've got an HR department that's really big and they're not really giving you the information you need. So we have people who come in and we go through their plans with them as well, just so that you get a better idea of how to use it. There's no point having insurance if you can't use it and you don't understand how to use it. So we want to make sure that you're able to do that. Okay. Next slide. Again, the deadline. This is our toll-free number. So the coverage begins January 1st, so long as you sign up before December 15th. And then our toll-free number is right there. If you get a voicemail, it's because we're really busy, but please leave a voicemail. Don't just call 20 times. Just leave a voicemail and we will get back to you as long as your name and number is on it. No question, there's no stupid questions. So even if you're like, oh, I don't know if this is really, just call us and ask. And again, if you're struggling with your Medicaid coverage, that's something that we specialize in as well. So just let us know if we need to help you out, okay? Next slide. This is Medicare open enrollment information. Again, the deadline ended yesterday. So we're all very tired because we worked really late and trying to get people signed up. But this isn't the only time people sign up. Sometimes people get really confused with this deadline. So if you have people who are on disability, who have Medicare, or who are low income, who have Medicare, they might qualify for some savings programs that they don't know about that opens up special enrollment periods for them to sign on and get plans. So just any questions throughout the year. We're not only open during these 3 or 4 months, but anytime throughout the year, people have information, need information about coverage, tell them to give us a call. Next slide. Sorry. This is some of the training that we have available. So if you are involved in an organization or you're at a workplace that could need some sort of education around any of this type of stuff, then we can come in, we can do it over Zoom. We can come in and speak to a group, happy to provide materials for people. So these are some of the things that we specialize in. So insurance specific information. If you need Medicaid, Medicare, ACA, overview, public policy, stuff that's coming down the pipeline nationally. And then we also do service delivery and then staff, taking care of yourself, burnout, and then goal setting information. So if you have any need for any type of training or any extra information, let us know. All right, next slide. All right, this is my number. So if you have any questions, again, you can call the toll-free number, or I'm happy to take calls. This is my cell phone. It rings straight to me. You can text, you can call, you can email, whatever is most helpful. Just reach out, let us know what you need, okay? Does anybody have any questions?
No, ma'am, not for me so far.
All right, just let me know if you need anything. Thanks, Vicki.
Thank you, Sonia. I do see Origin SC is here, and I'll tell you right up front, we're having challenges with screen sharing on your side. So let's see what we can do. I can probably give you the Origin SC website if that would be helpful to start.
Yeah, I mean, that will be just enough. I can.
Okay.
Yeah.
Okay. I will get, why don't you go ahead and introduce yourself, and I will get that set up here momentarily.
Thank you. Hi, everyone. My name's Lindsay Jenkins. I work with Origin SC. I am the marketing and outreach coordinator. So I am just going to give you a very brief overview of a few of the programs that we have at Origin. I'll start while you're looking for the website.
Yeah, I had it set up. Apologies. I'm very new to this, so it's not working too well. Sorry.
Do you need me to send it to you in an email?
Yes. Can you do that? I thought I had it here ready to go. It's not appearing, unfortunately, on my screen.
Okay.
Technology is not my friend. All right. Oh. Okay, let me try this again. I think I found it. We are here. There we go. Can you see that, everybody? Origin SC?
Everybody good?
Yes. Yes.
Okay.
All right. So you can just leave it here for a moment, and I'll
Okay.
tell you where to go. Yeah. So our mission at Origin SC is basically we empower individuals to achieve housing and financial stability. We do this through advocacy, counseling, and education. So the first program that I want to talk about is the programs tab up at the top.
Yes, ma'am.
Hover over it. and
Homeownership?
Go to financial go back. Yeah, financial education and coaching.
Okay.
Just click on that.
Okay.
So we offer financial education and coaching. We have several free workshops that we offer. We have debt management, credit improvement and budgeting, an intro to home ownership, and all of those are free. You can register for those on the website. It's all virtual, so everything is done that way. Actually, I think the intro to homeownership is $10. So will it let you scroll down a little?
Sure.
There you go. So here you can click on all the tabs and kind of, go in your individual direction if you're having issues. Our financial education and counselor, she's licensed credit counselor. Actually, the majority of staff that works there, her name is Fabia, and she is absolutely amazing. So yeah, she'll help you through whatever she can. Sometimes it's just as simple as like tweaking our budget, and it makes a world of difference. And the next program, well, does anyone have any questions about that?
He comes to my house.
We good? Okay.
Continue. Yep.
Okay. Go back to programs. You can click on the homeownership tab.
At the top, let's see.
Straight at
This
homeownership.
one.
Click on that one.
Mhm.
Just click. Yep. So part of helping people achieve housing stability, I've heard a lot of people say, oh, homeownership, that's not possible for me. I can barely pay my bills now as it is, but I'm here to tell you that you can. I did it with the help of the financial counselors at Origin, and our programs make it so that it's very much in reach for the majority of people. It just might take a year, it might take a couple years, but keep dreaming. No dream is too big is what I like to tell people. So if there's a will, there's usually a way. All right. If you're interested in learning more about homeownership opportunities, it's good that we're showing the website. I just invite everyone to get on the website and click around on the different tabs. And if you have any questions, you can always call 843-628-3000. And they'll help you with whatever you need. So if you go to programs again and go down to housing stability and then down or go over.
Sorry, go back to housing stability.
To the homeless prevention one at the bottom right there. Yes.
Okay.
So Origin also from time to time when we have, depending on the grant money that's come in, we can offer rental and utility assistance. If you need to apply for that, this is Casey. She's the director of that program. She asked me to share this with y'all. You go to this page right here, the homeless prevention, and I can send this link out as well to you again, Vicki, so that you can share with all the people who are attending. So this is where you go to fill out the application. If you scroll down a little bit, yep, see right here under rental assistance, there's no option to click the application because we've just run out of funds. So when we do have funds, it will be up. But in the meantime, you can always call that hotline. And should I type it in the chat screen or just say it?
Yeah, go ahead and type in the chat screen. We're going to try to compile all the questions and comments and resources, and then we'll send it back out to everybody through the parent advocate so everybody will have access to this information.
Okay, so I'm gonna type that in. And yeah, there, like I said, there is an application and there are a few requirements, and you have to have documents and things like that in order. But the staff in that department really is amazing, and they walk you through it. So there we go, 2301. Does anyone have any questions about that? I know I went really fast through those 3 programs, but that is the gist of it. Like I said, a lot of those workshops for financial education are free. So I just encourage, if you're struggling in that area, to just take advantage of those. It's kind of hard. Like, I feel like talking about money in our culture is kind of like taboo. People don't like to do it, but the staff at Origin really like makes it, how do I say it? We break down that wall. So there's nothing to be ashamed of or anything like that. Like I said, I went through our whole program, so it is possible. Okay.
Thank you. Again, for everybody on the call, some people joined late, we're going to have all the links, all the emails and contacts sent out through CPN and our parent advocates, and we'll make sure that this information gets shared back out more publicly with the community as well. So thank you.
Thank you.
Origin SC, anything last minute comments you'd like to add? Otherwise, we'll go ahead and move on.
No, I hope everyone has a happy holiday.
Thank you so much for being here.
Thank
Our next group is going to be Palmetto Goodwill. And Monique, are you on the call? Or Ilsa?
Yes, I am here.
Okay. Let me know how I can help you. Go ahead and you can jump right in.
All right. Do you need the slides, or you need me to share my screen?
Can you see my slide right now, or you can't see the Palmetto Goodwill slide? It's not showing?
No, I see you though.
Okay, here I go. One more time. Do you see it now?
No, ma'am.
Okay. Life is good. Hold on, folks. Reminder to Vicki, we need more tech assistance next time. I will get it together. Bear with me. Let's see, where are we?
Well, while
I want
you
to share screen. All right, I'm with you now. Palmetto Project is right here. Oh, sorry. That's not the one. I was over on, goodness gracious, Aloysius. Goodwill. Here we go.
We send it to you.
Oh no, I got it. I just didn't have it in the right.
There we go.
Okay. All right. One more time to the charm. Good now?
There we go.
Thank you all. Thank you for being patient.
Thank you, Vicki. Thank you so much for this opportunity for us to hop on really quick and just share a little bit about Palmetto Goodwill, some of our services that we offer. As most of you all know, I'm pretty sure you're familiar with Goodwill, the retail side of the house, and bargain shoppers. I'm pretty sure we have some bargain shoppers online as well. But I am here today to talk about our mission side of the house. Some services that many of you may not know that we offer. So today I'm going to talk about our career credentialing services, job readiness services, job placement, and our supportive services that are allowed for some of those eligible clients. Vicki, can you go to the next screen? Again, as Vicki mentioned, my name is Monique Smalls. I'm the Grants and Programs Manager here at Palmetto Goodwill in our missions department. And basically what I do, I oversee one of our programs, our program that actually helps individuals that have been laid off. They actually lost their job, been laid off due to downsizing. Hear a lot of feedback. Sorry.
Anybody can mute if they are not actively listening would be good. Just to mute your voice, please.
Thank you. Yeah, so oversee that, do both our financial and our grants that we receive. So now just talk a little bit about our mission. Our mission is helping people achieve their full potential through the dignity and power of work. So what the services that we do offer that helps people with employment and training opportunities, that definitely falls in alignment with our mission, as we are assisting those individuals to help them get reemployed, help them to get sustainable wages, and help them with upskilling in any trainings that they may possibly need. All right, Vicki, can we go to the next slide? Thank you. All right, so for Palmetto Goodwill, we actually service 18 counties. We service the Grand Strand area, which is like that Myrtle Beach area. We also do Florence, we do Sumter, we do the Tri-County, we do the Low Country. And as you can see on the map, we can go far out as Orangeburg and Calhoun counties as well. However, for today's exercise and seminar, we're going to be focusing mainly on the Tri-County area, which is Berkeley, Charleston, and Dorchester counties. All right, next slide, please. All right, and this number will definitely be up again at the end of our presentation. It's just basically that number that you can call to contact us about our services. 843-566-0072. So remember that number, and I'll have that on the screen again. Thank you, Vicki. Next slide. Okay, so as I mentioned, we do service the 18 counties, but today definitely we'll be focusing on the Tri-County areas, which is Berkeley, Charleston, and Dorchester counties. So on the mission side of the house, we actually have virtual career navigation services, where you have career navigators that will help you with employment plans, helping you with any training needs that you need. And our career navigators are available Monday through Friday from 8 a.m. to 5 p.m. And you can also see we have the number, and you can also reach our career navigators through our website at palmettogoodwill.org. Also for the Berkeley, Charleston, and Dorchester County, we do have career opportunity centers that are available. So if you need any resume assistance, you actually need to, virtual may not work for you, may need to meet with one of our career navigators. We have 2 career opportunity centers that's open in the Tri-County area from 10 a.m. to 3 p.m. One here at our Rivers location at 2150 Rivers Avenue, and then the other one in Dorchester County, which is in Somerville at 1817 North Main Street in Somerville. So if virtual doesn't work for you, but you definitely want to come in and utilize some of our assistance to help with job placement and resume assistance, you can definitely visit one of our career opportunity centers. Next screen, please. All right, so I did talk about our services, and I mentioned the word career navigation. So how we are able to assist clients to navigate them, or to kind of steer them into a path of training and job placement, we actually use a evidence-based career coach model called Career Navigation Model. It actually has a credential through Skilling America, in which all of our career navigators has received this certification. They are trained career navigators to really coach you and to really train you to at your past job experiences, listening to what you want to be, like my manager always says, what you want to be when you grow up, just to kind of help you get to reach those goals and reach those employment goals that you may have, to kind of steer you in the right direction, either it's with education, training, or even being that connection point to other jobs where you will be able to partake in and have those self-sufficient wages. All right, can we go to the next screen? All right, so this is one of the services that we do offer. We offer at no cost to applicants, and they're qualified applicants. We'll talk a little bit about that later on in the presentation. So those services that we offer, we'll talk to you again about, that's training services. So if you need any type of training, we offer those services. Job readiness courses, we offer those soft skill courses, helping you learn how to dress for success. We actually do that. Our career navigators help with that. Making sure you have ATS compliant resumes, and any other things that you may need help with as far as making sure you're ready for that job that you like. We have job placement services. We do have a job placement coach here. She's kind of like our liaison between businesses that are hiring and helping to connect those clients to those businesses and those different industries that are hiring in those fields. And then also we offer some type of supportive services that's related to that client going to training, or if that client needs some type of supportive service that's related to employment needs. Next screen, please. All right, so now talking just a little bit about some of our training opportunities, especially with COVID happening, we are able to work with this organization called Ed2Go, where we're able to offer online trainings anywhere from some of our clients, they never received their high school diploma. So we have online classes where they can get their high school diploma, but not just their high school diploma, but they can also add on a career component to that. So say, for instance, you need your high school diploma and you want to focus in early childhood education. We have that available to you. We also have online fundamental courses. Say, for instance, you've been working in the retail or you've been working in customer service all your life, but you want to switch tracks and go into the medical field. We have fundamental courses available to you where you can kind of try some of those medical courses out to kind of see if that would fit what you would like to do. And we also have those online advanced career training courses like pharmacy tech, medical coding and billing. We even have one called ethical hacker. So in the IT field. So I think at our fingertips, we have over 200 online courses that our clients can actually choose from what career path they would like to go through. And with that Ed2Go site, it's actually backed. We actually just did an agreement we have one with Trident Tech, Clemson, and USC as well. So any one of those classes that's offered at those universities or that technical school, that's within our pipeline of trainings, our clients would have privy to those trainings and certifications. Before I move forward, do we have any questions? All right, I guess I'm doing a great job. All right, Vicki, can we go to the next slide? All righty. So like I said, we talked about the online courses. We also have courses, those industrial courses. We have a partnership currently with Palmetto Training Institute, which offers manufacturing, Class A CDL, welding, and HVAC courses. So, and I did put some dates out here. So if you're interested in coming through us and seeing if you're eligible for some of our programs, I did have some dates for our industrial in-person classes that will be beginning on January the 11th. So those are definitely courses that are selected by a lot of our clients because they do offer like those self-sufficient wages, and you do get that national certification attached once you've completed that that training module. We also have a partner with Latrice D. Ferguson School of Nursing in Walterboro. That's another in-class, in-person training that we have. They offer nursing assistants, phlebotomy, patient care technician, clinical medical assistants, and EKG technician classes. So that's one of our in-person medical training providers that we have a partnership with as well. And like I said, all of these trainings are at no cost for qualified applicants. So that training piece that will help you get to that next level and land that job, we want to make sure that we have that available to our clients. Any questions before I move forward?
How do you qualify for the program?
What's your name?
It's Irosha. I'm the parent advocate.
Hi, Irosha. You know, I'm going to answer that in a few shakes. Okay. All righty. Can we go to the next slide? Alrighty, so now, and I mentioned this a little bit, talking about our job readiness aspect of it. So we may have clients, and I know I'm carrying a caseload as well. So I've had some clients, they've never done a resume before. They've been on their job for the last 30 years, so they didn't really need a resume. So we help clients building those ATS compliant resumes. Those are the resumes that they make sure that they don't go in the trash when human resource individuals are looking for them, making sure that we have those right keywords on that client's resume to make sure that their resume is competitive amongst those other clients that are looking for those viable jobs as well. We offer basic computer training as well. So, you know, sharpening up on your Excel and sharpening up on your typing skills. We also offer that. Interviewing skills. We do mock interviews. Our career navigators, they do mock interviews with some of their clients as well. And any of those job preparedness skills. We talk about soft skills. So making sure, you know, you have to be punctual, you have to be on time, you know. So talking about all of those things, because one thing that we want to ensure that when we actually send our clients out there for that job market, that they are ready. You know, they know how to answer those interview questions. They know how to present themselves. They know how to dress. And our career navigators, we will deal with all of those different issues and different scenarios as we're talking about the job readiness part of our services. Okay, can we go to the next slide? And then finally, it's not just about preparing you for a job, but it's ultimately getting you job placement. So that's our golden ticket. We are not doing an effective job if our clients are not able to get a job. So I was saying earlier, we do have someone on our team that is working with those that's working with those other industries and those other employers that are hiring, trying to make those connections for our clients. So we also help our clients find job announcements. So we do our part, but we also are training our clients to actually look for jobs as well. So we help them finding job announcements. Again, we're building employer partnerships with those employers that are hiring, helping navigate the clients through the hiring process of things that they need to look out for, things that they need to make sure that they know about the process as far as it relates to those different industries and companies. And then finally, we have on-the-job training opportunities. Again, say for instance, if you're going through a CDL course, you completed the course, but you don't have any CDL experience. So we do have certain pots of money where we can kind of engage that employer to do an on-the-job training opportunity for you, where we could pay up to 75% of your salary for the first 90 days. So it gives that employer some ease, whereas they're training you and giving you more experience on the job, that we're able to take care of some of those costs for them. So it's definitely a great program and definitely something that employers are engaged in. All right, so before we go to the next screen, do we have any questions? All right. Okay, so finally wanted to talk about our supportive services. And I know some other organizations, they offer supportive services to clients as far as rental assistance, utility bills. So we also offer those types of assistance as well. It's actually related to job placement and any training that the client that may need. So say for instance, we have a client that's going through the CDL program, but they have some hiccups with their driver's license. You know, they may have some suspension on there. To make sure that that client can get into that training, Palmetto Goodwill will pay for that person to get their license back in track. So any barriers that that client may be facing that will not make them successful to going through training or getting that job, we're here to provide that as well. So as you can see, we help with uniforms, footwear, equipment, transportation. You got to have transportation to get to back and forth to class. We're not going to buy you a car. However, we will provide gas cards, or we will provide Uber assistance to you. Vehicle repairs, we've done that sometimes. Medical support and physicals and dental wear. So there's a big array of services that we can support clients with as it relates to those supportive services based on training and helping to alleviate any barriers for job placement. All right. Any questions before I go to Ms. Washington's question about who qualifies? All right, next screen. All right, who qualifies? So currently we have funding for veterans, their spouses or caretakers. So if you are a veteran or a spouse of a veteran, or you take care of a veteran, you would definitely qualify for one of our programs. If you are underemployed or laid off individuals, so underemployed, let's say for instance, you were working at one job, but now you have another job where you're making less money than what you were making, you're considered underemployed. And person that has been laid off, that's kind of simple. You know, especially with COVID, we've definitely seen a rise in those individuals coming through our doors that have lost their jobs. So either the company has shut their doors, or they've just had to lay off some people because they can't afford it anymore. You definitely would qualify for our program. And then finally, any individuals that are receiving SNAP benefits, formerly known as food stamps. So if you're currently receiving SNAP benefits, you would also qualify for our program as well. Ms. Washington, does that answer your question?
Yes, that helps. Thank you.
You are quite welcome. You're quite welcome. All right. Well, do we have any other questions? All right. Well, it has been a pleasure speaking with you all today. Again, that number, if you all are interested in giving us a call, is 843-566-0072, and let Goodwill help you. Thank you. Thanks, Vicki.
Thank you. Thank you. We're going to jump on over to our folks over at MUSC here. Thank you for being able to hang in there for this entire time, Kelly. Just to summarize kind of where we've started and where we're winding up, we have gone over a little bit, but I think it's worth hanging on. If you need to jump off at 1 o'clock, I understand, but this is being taped and you can come back and look at it later. But we started off with Feather Healthcare Network. They talked about the family health centers that are in our nearby locations, downtown in North Charleston, behavioral health, OBGYN, dental supports, sliding scale. There's a lot of great information they shared with us. We followed that with Palmetto Project. They talked to us about insurance and how to access insurance options that are affordable, and along with prescription drugs. We had Origin FC talk to us about housing and utility and mortgage assistance and home ownership programs, followed by Goodwill, who just gave a great presentation. So just going to kind of wind up here with our last presenter, who's Kelly Garber. Kelly's with MUSC. She's been working with us for a number of years in our school-based health program. We have been kind of partners with MUSC since probably 2011 with our program that we call the KidsWell program, school-based health. MUSC does have a lot of other great programs in the Charleston area and across the state. So I'm going to go ahead and let her get started talking about her work in school-based health. And can you all see that? I think I may not have done the screen sharing again correctly. Anybody see the screen?
No, we can't see it yet, Vicki.
Okay, I'm so sorry. I need to get this together here. Bear with me one more second. I will try it.
While Vicki's pulling my slides up, I'll introduce myself again. Kelly Garber. I'm the lead nurse practitioner with the Center for Telehealth at MUSC. And we're thrilled to partner with Charleston Promise Neighborhood and KidsWell to bring healthcare to schools in the Charleston area. And we have several schools in partnership with CPN where we provide in-person care 1 day a week. And then we extend care throughout the week through telehealth. And I'll show you in a moment a brief slideshow about the program and how you can access care for your children, particularly at Mary Ford. And we have Nurse Stephanie Nauman on, who is a wonderful school nurse at Mary Ford this year, who is incredible to collaborate with.
There it is. I don't know why. Okay, I think we're with it now. Sorry.
Oh, that's
It's been a
okay.
day.
I
Okay.
understand. It never seems to work when you want it to, right? So
There we go.
thank you. And you can go to the next slide, Vicki. Thank you. So before I jump into what is school-based telehealth, I just want to say that I appreciated so much the presentation earlier from our partners at Fetter Healthcare. They are great partners of ours and truly respect all the work that they're doing and what they offer to people in the community. Our goal is not to replace the local medical home or partners like Fetter. It's to partner with them or extend the care that they provide in collaboration with our team at the school. So our goal is not to be the primary medical home for the children, but rather to offer services on site in the school when there are barriers to accessing care. So, you know, if you don't have transportation or can't take off of work, or there's not an appointment available at your regular provider, whatever it might be, our goal is to partner with that provider to just sort of make sure that the child gets the care that they need at the time that they need it. Next slide, please. So what is school-based telehealth? Well, it's high quality healthcare for children in the school setting using telehealth technology. And so we use secure HIPAA compliant video conferencing. So that means nobody can break into the connection or listen in or hear or see anything that we're doing. It's completely secure and private. And we use digital stethoscopes, otoscopes, and exam cameras so that I can actually do a full visit from a distance. And so as you see in the pictures here, when the nurse places the stethoscope on the chest or puts the otoscope in the ear, the provider at the distance site can actually see and hear in real time. Next slide, please. Appointments are scheduled through the school nurse. And at Mary Ford in particular, on Mondays, myself and one of our amazing nurses, Stephanie Kelly, is on site in person. And then all the other days, we can connect to Nurse Nauman through the telehealth equipment. Typically, the school nurse will do an initial assessment and determine if the child needs to be seen by a provider. If you've signed up for the program, then the nurse will call you and say, would you like the Kidswell MUSC team to take a peek at the child or to have a telehealth visit, depending on the day? And if so, then the visit will take place. Next slide, please. So we typically do provide some things that you would see in a typical clinic office, some asthma medications and strep throat tests and things like that. Now this year is a little bit different for us because of COVID. We're not able to do any strep tests or breathing treatments on site just because of the possible risk if someone actually had COVID of spreading those germs during those procedures. But in other years, we do include those things as part of our assessments. Next slide, please. And this is just a quick picture of our electronic stethoscope. It's really small, but I can hear better quality through this than I can with a traditional stethoscope. Next slide, please. And this is what we call a horoscope, and the nurse places it in the child's ear. In this particular picture, she's looking at a lesion on the skin. But what you see in that little square on the handheld device is what's transmitted to me through video. So like we're doing Zoom, only I can see the patient as well as what's being transmitted by the smaller camera. Next slide, please. So the typical kinds of care we provide are common childhood illnesses, you know, coughs and colds and rashes and lice, ringworm, ear pain, and the list really goes on. The only thing we really can't manage through telehealth is a true emergency. In that case, we encourage the school nurse to follow her already in place emergency protocols. But there are times when we do a visit and we realize that we can't complete the visit the way we should over telehealth. And if that happens, we would let the family know what our recommendation is and help facilitate getting you to the most appropriate care, whether that's the local medical home, whether it's a specialist, whether it's the emergency room. But for most things, we can at least initiate a visit and get a history and do a preliminary exam to determine what the best course of action is. We also are developing some programs to connect to pediatric specialists. They're in development, but we're looking at connecting to a pediatric lung doctor or a pulmonologist. And then we have one school where it's specifically focused on children with special healthcare needs. So in the schools where children have complex medical needs, we don't manage their complex disorders, but we can help with the common childhood illnesses that that population also gets. Next slide, please. We also have a special focus on chronic care management for children with asthma in particular. We work closely with the school nurses to see children who have asthma. We do regular follow-ups. We make sure that if they need a controller medication, that not only do they have the controller, but they know how to use it properly. We have free asthma education with a specialized asthma educator respiratory therapist that will recommend for the children and the families. We also work and partner with the school nurse to give controllers at school if that's appropriate for the child. We work with families just to make sure that everyone truly understands the medications and the appropriate use of the medications, the most appropriate and safest and most effective way to take the medication, for example, is all of these things are so important with helping kids with asthma. I've seen so many children over the past 6 years that parents will say to me, they just didn't know their child could be well with asthma, that they thought they'd always be sick. And if we get them under good control and proper control, they are just like every other child and can run and play and do everything that they want to do. And so the main thing I would like to impress upon you is if you have a child with asthma and if they're not able to get to the regular provider for ongoing routine follow-up care and things like that, please let the school nurse know, because we'd be more than happy to follow them at school and make sure that they get their medicines refilled when they need to and so on. We do the same thing for patients with ADHD. And we also have a telemental health team that we can refer to if a child has experienced a traumatic event and they have post-traumatic stress syndrome symptoms. So for example, being in a car accident or witnessing violence or experiencing violence, anything like that that has caused the child to have post-traumatic stress symptoms, our telemental health team has a wonderful program that they can work with the child and family to help them overcome that. Next slide, please. And this is just a schematic of the workflow. We have to make sure that children have a consent to participate in the program. And this can be done on paper or through an electronic format where we can actually just send a link and you can fill it out online. Once the form has been completed, it stays in effect as long as the child's in the school district. So even if they move from one school to the other, the consent stays in place unless a parent decides to cancel it. When the child presents to the school nurse, again, the nurse does an assessment. If she feels the child needs to be seen by our team, then she would call the parent to confirm permission for the visit. If we can't reach the parent, but we have that written consent on file, we can still go ahead and see them, but we won't send any prescriptions or take any action without talking to the parent, because we want to be sure we know what's going on with the child at home as well. Once the visit takes place, any medications are sent to the local pharmacy. And in some locations, we've partnered with Delta Pharmacy, particularly in Charleston, to provide delivery directly to the school. And that can be very helpful for families that have barriers to getting to the pharmacy. We can have their asthma medications, for example, delivered right to the school nurse. We always send a note to the local medical home so that we can make sure they know about any care that we've provided and that we're working together to provide care for the child. Next slide, please. Again, this just illustrates that we like to partner with those medical homes and make sure that they're involved in any of the care that we provide. Next slide, please. This is my contact information. Feel free to email me with any questions about the program or anything I can do to help. Nurse Stephanie Nauman at Mary Ford is a wonderful resource as well. She has access. I should have put the code up here for the electronic consents. I apologize, I didn't do that, but Vicki and Nurse Nauman both have that information on site, and we can also email you or text you the link if you'd like to sign your child up. Does anyone have any questions? I'm sorry, Vicki, I can't hear you. You might be muted.
I want to thank you all for participating. We're a few minutes over, and I just wanted to share very quickly the consent form flyer, because for those of you who have a child in one of our schools, at the beginning of the year, this form that I hope you all can see was sent out at the beginning of the year. It's also the little code, this little QR code is an easy way that you can sign up for the school-based health program that Kelly just referred to in our Charleston Promise neighborhood schools, which are Mary Ford, James Simmons, Sanders Quad, and Shakora. We call it Kidswell affectionately, but you as a parent or guardian can just put your phone over this square box, and that will open up the application for you to fill this out. And we also have paper-based copies in case this is not a convenient option for you, but this is actually an easier option to fill out than it used to be. Just to let you know some statistics, we have seen over 4,500 kids in school-based health with Kidswell and MUSC since 2011. We see probably 50 to 75 kids every year for asthma, about the same number for ADHD, behavioral assessments. The medications can be delivered to your home. We have a lot of families that take advantage of that, or to the school. It has been difficult this year for outreach. That's one of my roles with Charleston Promise Neighborhood, is to reach parents and let you know about these great programs. So we'll be working more closely with the parent advocates to do some of these more electronic formats so we can get the information out to you all. Because we do have lower numbers of parents involved in our school in terms of just not being able to come into the building. So it's making it harder for us to reach our families. So you'll be seeing me in the parking lots. You'll be seeing us sending out more flyers, look for things in your children's backpacks, look for things on your Facebook for your schools, and also your classroom Facebook or Class Dojo pages with this kind of information. So I don't have anything else to add at this point, but I do thank you all for your participation, and all this information will be recorded and shared. And if you have no other questions, I'm just sort of going through the chat to see we hit all the main questions from folks. I appreciate it. I think we'll close for now. And again, thank you, Arosha with Mary Ford. Thank you, Clifford from James Simmons, Kelly, Stephanie Nauman, school nurse, all of our other partners who are still with us at this point. And this is, again, just closing out, this is Vicki with Charleston Promise Neighborhood, and we hope to do this again. And I think this was a great first attempt, Arosha. I think the next time we'll have fewer speakers and make it a longer session so we can have more Q&A. But thank you all for being part of our little pilot virtual parent information session this afternoon. Signing off for now. Thank you.